one of the areas that is very high priority for proton therapy is children, the treatment of children's cancers. And we know that even very low doses of radiation in children can have devastating effects on growth and development. Growth in muscle and bone, development of brain tissue. So pediatric cancers is one of the top priorities in proton therapy. But I think that proton therapy will produce benefits in any cancer that we treat with radiation, because in every single site there's always unintended radiation dose to normal tissues with X-rays. These X-rays are like bullets. They pass through the patient and they leave a track of damage. The protons are very different. They stop in the target, so there's always going to be less radiation to the normal tissues regardless of the cancer, whether it's lung cancer, prostate cancer, esophageal cancer, pancreatic cancer, children's cancers, a tumor in the head and neck, a brain tumor. All of these cancers, there will always be less radiation to the normal tissues that you want to avoid with proton therapy compared to X-rays. In every site, there'll be a different side effect or a different complication that you would like to avoid, and it will be more likely that you can do that with proton therapy than with X-ray therapy. So I think there's a broad spectrum of indications for proton therapy. Sometimes the goal will be protecting brain function, as in children with brain tumors. Sometimes it will be protecting liver function or kidney function in a patient with pancreatic cancer. In a patient with Hodgkin's lymphoma or lung cancer or breast cancer, we may be aimed at protecting cardiac function. All of these goals are valid goals and important and can be achieved, I believe, well with proton therapy.